Appreciate your participation. We have a great presentation for you today. A couple quick housekeeping things before we get started. We have everybody's cameras off, I believe, and muted, and our session will be recorded. Thank you. We will have an opportunity to ask questions at the end, so you can either come off mute, or if you want to type your questions in the chat, I'll be able to field some of those. But with that, I want to turn it over to Dr. Mark Henschel from Penn Dental, who, along with his colleagues, are going to talk to us today about achieving health equity in the provision of dental services. So, Dr. Henschel, take it away.
Thank you very much, Mary Ellen, for that nice introduction. And yes, I am Dr. Mark Henschel. I'd like to introduce two of my AEGD residents, Dr. Timlin Heacock and Dr. Mirza Bayeg, who will also be part of this presentation. Before the presentation starts, I'd like to make a few brief comments that Penn Dental Medicine focuses on integrating comprehensive care tailored to individuals with disabilities, emphasizing the importance of individualized treatment plans. Our approach includes faculty and residents receive specialized training in addressing the unique needs of patients with disabilities, ensuring they can provide appropriate care. We also work with collaborative care models by working closely with other health professionals. Penn Dental fosters an interdisciplinary approach that considers the holistic health of patients. Wood's system of care complements these efforts by promoting community-based resources and support for individuals with disabilities. Key initiatives will include outreach programs. These programs aim to raise awareness about dental health resources available for the disability community, ensuring individuals are informed and empowered to seek care. Accessibility enhancements. The system prioritizes making facilities and services readily accessible, removing physical and systemic barriers to care. Together, Penn Dental Medicine and Wood System of Care are not only improving access to dental services, but also fostering an environment where individual disabilities can receive respectful, equitable care tailored to their unique needs. Our collaborative initiative serves as a model for how targeted approaches can lead to significant advancements in health equity within dental medicine. This collaborative effort highlights a broader commitment to dismantling barriers and ensuring that every individual, regardless of ability, has the opportunity to achieve optimal dental care. At this point in time, I'd like to hand it over to Dr. Timlin Heacock and Dr. Mirza Bayeg to continue with the PowerPoint presentation on achieving health equity in the provision of dental services.
Thank you, Dr. Henschel. Can everybody hear us?
Yes, we can all hear you.
Okay. Hello, everyone. My name is Timlin Heacock.
And my name is Mirza Bayeg.
And today we're going to be discussing how Woods and Penn Dental Medicine have partnered to improve access to oral health care for individuals with disabilities and specialized healthcare needs to achieve health equity in the provision of dental services. So oral health disparities occur when certain groups of people experience poor oral health outcomes and reduced access to care. Individuals with disabilities often face significant barriers to receiving dental treatment. And so to kind of overcome that, Woods partnered with Penn Dental Medicine in 2023 to expand access to oral health care for individuals with disabilities. The partnership combines Penn's educational resources with Wood's expertise in caring for individuals with complex healthcare needs. So some of the populations that we treat include individuals with autistic spectrum disorder, intellectual or behavioral disabilities, and mental health and medical complexities. Treating the patient is very important. It's very important to treat the patient who has the condition as opposed to the condition. And that kind of helps us understand the full story and better treat and provide access to care and have better oral health outcomes with our patients and from my experience. Certain conditions increase the risk of dental disease, while others impact the patient's ability to maintain oral hygiene independently. Some patients may have difficulty tolerating treatment or communicating discomfort, so it's very important to have systems in place to be able to understand and provide the best oral health care and health outcomes. And as providers, it's very important that we understand the unique challenges of this population and adapt our care accordingly. So these are just some of the patient populations that we treat here at Woods and at Penn Dental Medicine. The collaboration of Woods and Penn has two primary goals. And the first is to provide excellent oral health care for individuals with disabilities. And second is to educate and prepare future dentists to care for patients with specialized healthcare needs. By addressing both patient care and provider education, we can create long-term improvements in access to care. I know for me personally in dental school, I didn't have much experience with this specific healthcare population. And so this experience has been invaluable to me for learning how to treat these populations and making provisions to my care to be able to increase health outcomes. Specialized dental care is important for individuals with disabilities because these diagnoses can directly affect how a person experiences, accesses, and maintains oral health. It can affect risk for certain oral health diseases and the ability to tolerate and complete treatment. So why is it important to have specialized care? Frequently, we see differences in communication and sensory sensitivities among the special needs population. And so the dental environment can be very overwhelming for these patients due to bright lights, different sounds, textures that you experience in the dental office. And so there should be provisions made in the dental office to address those different needs. And things that are very routine, such as suctioning, polishing, can be very distressful to patients and cause a lot of anxiety and ultimately hinder the ability to provide equitable and, just the appropriate amount of care. And because of this, treatment often needs to be more predictable, slower paced, and tailored to the individual's needs. Techniques such as desensitization, behavioral guidance, and clear communication can make a significant difference in a patient's experience. So this picture kind of shows some of the alterations in the dental clinic that is made here with Penn Dental Medicine and Woods. This picture is in our quiet room, which is an isolated room that is good for low stimulation environment to carry out treatment in a way that's safe and comfortable for the patient and safe for the providers as well. The room is isolated, so we can close the door and tune out any of the loud noises that are going on in the rest of the clinic. And it's been very useful for providing care for patients that we've seen here. And the impact of health conditions on oral health is another thing that we like to focus on here at Penn Dental Medicine and at Woods. So different health conditions can affect oral health in different ways. Individuals with intellectual disabilities might have difficulty understanding oral hygiene instructions or post-operative care recommendations. So this often increases the dependence on caregivers and highlights the importance of prevention and caregiver education. Medical complexities can also impact oral health. Systemic diseases can influence how we plan and provide treatment. So for example, different medications can cause dry mouth, gingival or gum overgrowth, and increased bleeding risk. So it's important to make alterations to treatment to address these issues in a way that's safe for the patient, and has better outcomes for overall health. Mental health conditions also affect health outcomes. So if a patient experiences anxiety, depression, or other mental health challenges, that can lead to dental avoidance or difficulty maintaining oral hygiene. In addition to that, behavioral challenges can create barriers to receiving treatment and may require additional behavioral support strategies. Some of our patients also have mobility limitations, which can make it more difficult for them to brush their teeth or do the routine things to implement oral health care at home. And so that's why we do what we do here. And so it's important that these factors are reinforced, and why individualized healthcare approaches are very important, because everybody has different needs, whether it's intellectual, behavior, mobility. There are different things that need to be implemented to enforce that those individuals are receiving equitable care. And some common oral health factors that we see in this population, as we see several oral health risks factors being elevated. We see trauma and injury in the mouth that may occur more frequently due to falls, accidents, or self-injurious behaviors. These individuals take multiple medications, and that can negatively impact the oral health, and cause side effects that we must maintain and treat. So access to dental care remains a major challenge for many patients, and as a result, we see higher rates of dental caries, periodontal disease, malocclusion, and bruxism. And so understanding these risks is the first step on focusing on prevention and early intervention and making a difference in these communities. And with that, I will pass it over to Dr. Bay.
Thank you so much, Dr. Hickok, for sharing the barriers and unique challenges dealing with the special care need patients. I'm going to start with introducing the Woods, the services and the Woods Center. We have a state-of-art facilities at Woods for dental services with 5 operatories. To better serve this population, Penn Dental Medicine would establish the Mikey Flourner Dental Center. This is a state-of-art facility designed to meet the needs of the patient with disabilities. The clinic includes 5 operatories, digital imaging technology, electronic health records, and advanced dental equipments. These resources improve efficiency while enhancing patient comfort and quality of care. The clinic was especially designed to support comprehensive dental care for individuals with specialized healthcare needs. Our practice is ADA accessible. The ADA accessible refers to the environment both physically and digitally that meet the American with Disabilities Act standards by ensuring equal accessibility for the people with disabilities. Penn Dental Medicine at Woods, our site provides the AEGD training, is an AEGD training site where 4 residents rotate each day, 3 days per week. And this is one of our very first day when we came, and we get a warm welcome at the Wood Center. And starting with introducing one of my publication where I have discussed the oral health challenges and innovative model for the patient with the special care needs. This framework presented shows that the barriers, as Dr. Hickok discussed today, the communication barrier, limited health literacy, transportation challenges, providers barrier, and system barriers. And if we focus, I want to focus on the second providers barrier, where enhancing training programs and incentive structure development for specialized clinic. So individual with special care needs, including those with physical, developmental, cognitive, sensory, behavioral conditions, experience high rate of disease and faces persistent barriers to access to dental care. These disparities stem from multifactorial challenges at the patient, provider, and systemic level, including limited oral hygiene capacity, inadequate professional training, fragmented healthcare delivery. This paper explores the oral health challenges of special care need patients and propose an innovative model emphasizing preventive approach, interprofessional collaboration, medical dental integration, and teledentistry mobile care unit. Our model at Woods supports the workforce development through structured education in special care dentistry and promotes sustainable access through blended financial framework involving public, institutional, and insurance-based support. Ultimately, our system, our framework aims to reduce the oral health inequalities and enhance quality of life by advancing inclusive, preventive, community-centered dental care for individuals with special care needs. So that makes our AGD program, that's because the proper training, proper providers who are used to of the environment, and they can apply those techniques, especially designed for dealing with special care needs, that we have is very short in the country, and at Woods we can avail all of this. So it's preparing the next generation of dentists, and Penn Medicine Advanced Education AGD program objective that meets our new dentist education standards, train the AGD resident to serve the primary care provider for oral health. And they function effectively in interdisciplinary healthcare team, collaborating with physicians, nurse practitioners, nurses, social workers, behavioral health specialists to coordinate the care. We use the principles of evidence-based and patient-centered approach. And we are living in the era of personalized medicine. We are transitioning from a specialty to the personalized medicine, and we can implement at Woods, engage with the community in a culturally relevant and sensitive manner. Penn Medicine 1-year AGD program entails combination of clinical, didactic coursework, clinical care rotation at the Woods. Since January 2023, AGD residents have provisioned more than 15,000 oral health procedures for people with disabilities within a Wood care system. These are some of the statistics that examination we provided since January 2023. The number of not only the routine clinical exam and prophies, we can see some of the more extensive treatment, including crown extraction, root canal, sedation cases. We all see at the Penn Dental Medicine. We refer them a patient there, and at the bottom of this, you can see 30 behavior management, but it's way more than what you see the data over here. Because we basically manage the behavioral management for all of our patients. What we can do increase the oral health outcome, providing the very little techniques, these techniques like tell, show, do, counting, desensitization, visual cues, and they look very minor techniques, but the outcomes are very promising, and they stand out and make a difference in the patient care. Routine dental visits are vital and medically necessary for the special care need patient because the individuals have physical, sensory, and cognitive challenges that hinders daily oral hygiene, that at much higher risk for severe dental disease, chronic pain, and systemic infections. So routine care offers highly specialized preventive benefit that far away than the challenges of a dental visit, and why the specialized modification make difference in tailoring the environment to specific physical and behavioral need. These modifications, as we discussed, uses positive reinforcement, behavioral desensitization technique, adjusting appointment for those who are sensory sensitive, offering sedation or general anesthesia when cooperation or tolerance during the complex procedure is limited. And why the routine dental visits are so important, because it's all about lowering the burden of the disease. We can prevent the severe complication, professional cleaning, provide treatment, dental sealant can stop the cavities, gum diseases, and can prevent the irreversible damage or pain to the patient. Avoiding these emergencies, untreated oral infection can trigger systemic infections such as cardiovascular disease, diabetes complication, respiratory infection. Preventing these diseases reduce the need for complex emergency procedures that require hospitalization. Managing medical side effects. Many medication prescribed, as Dr. Heacock shared with us, can cause dry mouth, rapid accelerating tooth decay. The dentists monitor these changes and provide immediate tailored mitigation strategies. And one of the most important thing is the trust building. Consistent routine checkup familiarize the patient with the clinical environment over time, significantly reduce the anxiety, building a trust relationship with the dental team. And what's the biggest challenge for anyone, and especially for the special care need patient? That's the access to the healthcare. And however, living closer in the healthcare services where patient can easily access the services can make their life very easy. Patients with healthcare needs require continuous reforms to overcome the extensive barrier, as we discussed, through that educational innovations, interprofessional collaboration, preventive care emphasis, policy-driven financial reforms, and our model at Woods propose a scalable, equitable approach, measuring success indicators such as increased provider engagement, improved patient satisfaction, and reduced disease prevalence defines our model's effectiveness. Ultimately, the integration of medical dental systems supported by sustainable financial mechanism is transforming the oral health landscape for special care needs population in our community. And thank you so much. And if you have any question, we can happy to answer that. And if you think you need to contact us, is Dr. Henschel's email address given.
Thank you so much. That was fantastic information. So we really appreciate you guys presenting. If anybody has questions, feel free to come off mute or you can type them in the chat. I can't say enough good things about Penn Dental. If anybody is ever interested in coming and taking a tour, we do them often on Tuesdays and Thursdays, and it's just seeing all this PowerPoint is great, but seeing it in person, it's just incredible. So the pictures don't do it justice. It's an amazing program. Anybody have any questions? Dr. Henschel, anything else you want to add?
No, I think that was a very nice job that was done by all involved. And I thank everyone for the opportunity to show what we at Penn Dental Medicine, in collaboration with Wood System of Care, are being able to do for not only patients within the Wood System of Care, but also those in the surrounding communities. I think this is a fantastic collaboration, and I hope it can only grow from here.
Absolutely. Thank you, Susan. Yes, very appreciative that Penn Dental is on campus. Great job. So thank you all. If again, Dr. Henschel's email is there. I can put my email in the chat as well. Like I said, if I'm happy to coordinate tours for anybody, if you'd like to come and see it and haven't already. Yeah, thank you so much. Lots of nice compliments in the chat. Thank you, everybody. Great facility, comforting, professional. So great job. Thanks all. Have a great
Thank
rest of
you.
your day.
Bye-bye.
One.
Bye.